The Model Systems Knowledge Translation Center presents Understanding and Improving Body Image After Burn Injury. This slideshow is based on research conducted by the Burn Model Systems and serves as a resource for individuals with burn injury and their supporters. The Model Systems Knowledge Translation Center is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. This resource summarizes the research on dealing with body image distress after burn injury. This resource can help people living with a burn injury understand why coping with body image can be an important phase of recovery that helps one feel satisfied, comfortable, and confident with his or her appearance. Body image is defined by how satisfied, comfortable, and confident a person is with his or her appearance. Body image distress can vary person to person and can fluctuate over time. Much of what determines body image distress depends on factors such as personality, history of depression, social support, social and coping skills, and how a person felt about his or her appearance before their injury. Major burn injuries can change how the body looks and functions, which can lead to body image distress. Approximately 1/3 of children and adult burn survivors report significant distress related to changes in the way their body looks, feels, and functions during the initial hospitalization. Fortunately, most children and adults adjust well with the passage of time. However, almost everyone experiences some ups and downs as they recover from burns and adapt to the change in their appearance. Burn severity and burn location do not necessarily determine how distressed burn survivors are about the change in their appearance. For example, one person may be very distressed about the appearance of a small burn, whereas another with very large burns may not be distressed at all about his or her appearance. Some burn patients may think that their burn scars are ugly and worry that others will reject them because of the scars. Some burn patients may think that their burn scars are ugly and worry that others will reject them because of their scars. Body image distress may also involve grief or sadness about changes in appearance and physical abilities, anxiety about social or intimate settings where the scars may be noticed, and worrying about how people will react when they see the scars. What are the phases of healing? After a burn injury, your skin goes through several phases of healing. The 3 phases are wound healing, scar formation, and scar maturation. During each phase of healing, it is important to follow the guidance provided by your burn team to improve how your skin heals. During the wound healing phase, what you see is light-colored skin replacing open wounds. The faster a wound heals, the less scarring will occur. What you can do is get involved with your wound care as much as possible, such as helping with dressing changes. A cleaner wound heals faster, and the more aware you are of your wound care, the more likely you are to take good care of it. During the scar formation phase, what you see is, after the wound heals, the skin changes over the next 3 to 4 months, becoming darker, stiffer, and raised. What you can do is, scarring is a problem, not only because of its appearance, it can also be disabling due to stiffness and pain. Work with the rehabilitation team to minimize scarring. Your team may advise you to wear pressure garments or splints, or perform scar massage or stretching exercises. During the scar maturation phase, what you see is that scar maturation can take up to 1 to 2 years. During this process, the scarred skin gradually returns to a more normal skin tone and becomes softer and flatter. What you can do is, the rehabilitation team may recommend that you continue wearing pressure garments or splints or performing scar massage and stretching exercises. Some of the cosmetic options available in the scar maturation phase include asking for help from people trained in the use of cosmetics and clothing to make scars seem less obvious. Certain cosmetic techniques and clothing styles and colors can help improve the appearance of scars. Consulting with a plastic surgeon who specializes in burn reconstruction can improve appearance and restore function through a wide array of techniques. Burn injuries not only change how your skin looks, but can change your appearance in other ways. In severe burns, body structures under the skin can be damaged. For example, cartilage in the ears or nose may be damaged, causing changes in these structures. Some burn survivors undergo multiple skin grafts and other reconstructive surgeries that can change the way they look. Skin grafts can result in hair loss because hair follicles do not regenerate. Sometimes burn injuries cause damage that requires amputation of fingers, toes, or limbs. Wanting to improve your appearance does not mean you are vain. Using cosmetics, clothing, or plastic surgery can help you feel better about your appearance and yourself. However, even with the best acute care, rehabilitation, and reconstruction, major burns often result in some permanent changes in the way one's body looks, feels, and works. Part of the emotional healing process from burns is learning to accept these changes. How do I get the support that I need? Emotional and psychological healing is as important as physical healing. It is important to get support from other burn survivors who may share your experience. The Phoenix Society, a U.S.-based nonprofit organization, has trained burn survivors available across the U.S. to offer support through the Survivors Offering Assistance in Recovery program, SOAR. Social interactions will change following burn injury. Some people react to seeing or meeting someone with burn scars for the first time by staring, avoiding interactions, or asking intrusive questions. Burn patients can learn coping skills to feel more confident and social skills to diffuse these uncomfortable situations and make them less awkward. There are several coping methods burn survivors can use to feel more confident interacting socially with strangers. Body language. Make eye contact. Use confident body posture. Smile, and use a friendly tone of voice. Be prepped to talk about your injury. Have a response prepared ahead of time to explain what happened. Some burn survivors have found that being able to talk about their injury helps with emotional healing. If you prefer not to discuss your appearance, you can guide the conversation to take the focus off you by asking open-ended questions about the other person. Open-ended questions are, you can ask questions that a person cannot answer with yes or no. For example, I heard you went to India. That sounds exciting. Tell me about your experience. Or politely decline and say that you do not want to talk about your injury. If you are worried about showing your burn scars during intimate experiences, there are ways to help you feel more comfortable and confident, such as being open and talking to your partner about your concerns, or getting the support you need to address your concerns about intimacy, such as talking to a health professional and other burn survivors. Parents and teachers need to closely monitor the child burn survivor's behavior and interactions with other people. Children often tease each other about even slight differences in appearance. Parents may not be aware of how severely their child is being teased. Children who are teased may become depressed or anxious when meeting new people. Early interventions by adults in a child's life can help protect them from teasing. Adults can teach other children some basic information about burns and how to treat a burn survivor with respect which can help create a supportive environment for child burn survivors. Parents should discuss the school's policies for minimizing teasing and bullying with school administrators. Burn centers often offer programs to help burn survivors return to school. School reentry programs generally involve a burn professional visiting the burn survivor's school before the child returns. The purpose of this visit is to explain the burn recovery process to the survivor's teachers and classmates, and to encourage the students to be caring and supportive of the burn survivor. Many families find this process helpful in creating a supportive environment for the burn survivor. Schools should have policies in place for minimizing teasing and bullying and for creating a supportive learning environment in the school. Parents should have a frank discussion with the school administration about these policies and how they are going to be implemented in their child's case. Some burn centers offer burn camps for children that are often free of charge. These camps offer children an opportunity to play and socialize with other children with burn injuries so they don't feel so different. Recovering from a burn can be emotionally difficult. Seek help if you are feeling anxious or depressed. Do not suffer alone. Many burn patients can benefit from speaking to a psychologist or counselor who has expertise in the psychosocial challenges of recovering from a burn. Your local burn center or healthcare provider can refer you to a mental health professional in your area. Some treatment options you can discuss with your healthcare providers are medication. Some survivors benefit from treatment with medications for depression and anxiety. Cognitive behavioral therapy. CBT shows people how to understand and the connections between their thoughts, emotions, and behaviors. It is effective in treating severe depression and anxiety and has successfully helped people with body image distress. Family therapy. A burn injury can put stress on the entire family and change the family dynamics. Sometimes, burn survivors and their families benefit from family counseling. Other research-based treatments for trauma can be discussed with your healthcare provider. For additional resources on living with a burn injury, please visit the Model Systems Knowledge Translation Center website at www.msktc.org.